Hi students, this is Dr. Srinivasan Patnam and we will be dealing about inpatient services part 2, types of inpatient wards, what are the different services available within the wards. Okay. Now, type of inpatient wards. Okay. These wards are different areas where the patient comes, as we discussed in part 1, the patient comes to the hospital, gets some services. So, how these wards will be there, what is the design, what is the size, and all these things we will be discussing in this session, part 2 session. Okay. Based upon the care provided. So, the hospital wards are divided into two types called general and special wards. So, general ward is like, it is not a very critical care area where the life saving treatment is not required. It is just like a patient is kept and the timely medication or timely services are given, and then the patient is treated accordingly and patient leaves. So, this is a normal care area where the minimal care services are available for the patient. That means where the patient is just made some observations based upon which certain treatment plans or care is changed, altered or modified, and then given to the patient, and the patient is, when the patient is fit, is discharged. Now, we have special wards, which is nothing but like critical care wards like ICU, nothing but intensive care unit, ICCU, intensive coronary care unit, or SIU, surgical intensive care unit, post-operative ward where the patients come from after the surgery are kept into that ward and treated, nurseries where the newborn infants are kept and treated, isolation wards like example patients where needs isolation, that means not staying with other patients, so they need to be kept separately. So, these patients, like for example COVID case, like if we have seen COVID patients are kept isolated from other family members or maybe other patients in the hospital and treated separately. So, like isolation wards needs to be where patients are treated as a single entity, and also burns ward where patients who sustained burns are kept and treated specially with special precautions to prevent infections. So, these are the different kinds of wards, special wards where depending upon the patient condition, depending upon the speciality, they are put into these wards. Okay. Medical specialty wards especially like gynecology and obstetric wards where the patients are female patients only belonging to having problems with gynec and obstetrics would be placed into that particular ward, or orthopedic ward where the patients having some problems with their bones or any other joint issues are admitted into those orthopedic wards. Like we have other specialty wards like wards related to nephrology, that means any kidney related issues, or wards related to neurology or nerves related issues. So, every specialty has a separate ward. Patients having problems belonging to that specialty are kept and treated accordingly. Now, let us see the other category, how the wards can be divided. So, based upon the facilities provided, that means different facilities, how they based upon the economical condition. We have economy ward where it is affordable for different kinds of patients, sharing rooms where two patients share one room depending upon their financial capability, and private rooms which are again of deluxe and suite type where these have different facilities which are not only pertaining to the clinical care or the inpatient services, but also have an extra facilities like how we have in a hotel room, like a specialized kitchen where they can prepare their own food, or maybe a relaxing area with sofa sets and entertainment systems like television. So, they have these specialized facilities other than the normal IP services which are incorporated into the deluxe and suite rooms. So, these are the different facilities available, and we based upon these facilities we divide these wards into three types like economy ward, sharing rooms and private rooms. Okay. Now, what are the key points that we need to consider when you are constructing as a hospital owner, when they are constructing these wards? So, what are the key points that needs to be considered to design these wards? Okay. The design should ensure the privacy and safety of the patients. Whatever the ward you design, let it be based upon the facilities or based upon the care that you provide. So, the patient should be having a privacy and safety. Okay. And it is recommended to have a single entrance and a single exit where the traffic can be controlled, and we can have an eye like who is coming into the ward and who is going into the ward, where the patients can be protected and treated accordingly. Okay. And design should be compatible to patient safety. So, the within the ward how the environment has to be is like it has to protect the privacy and safety of the patient. So, the floor, whatever the floor that is being designed should be non-slippery, like for any patient or even for the staff who are moving in and out of the ward, it should be non-slippery, so that they can walk without any fall risks. Okay. And we should there should be grab bars wherever the support is required for the patients to handhold these bars and move from one inpatient ward to other inpatient ward, or maybe when they are being transported to other care areas. So, or the patients can have some physical activity by grabbing onto these bars, so that they have that movement or physical activity within the wards. Okay. And doors without inside locks, especially if you see into geriatric cases where the patient goes to for example, into restrooms and they collapse there, and if the door is locked, so it is difficult for us to bring the patient back from the restroom and give the treatment. So, there are certain areas in the ward needs to be having a doors without locks, and every room or every ward wherever the patients are located within the inpatient services has to have call buttons in the washrooms or near the beds, so that they can call the required staff, let it be a nurse or a janitor who comes and helps the patient, so that in case of emergency or in case of need, they can press these buttons and the required help is given to the patients. Okay. And let us see the design, how the design should be, I mean in terms of clinical aspects. Okay. The design should allow good infection and infection control processes. The ward should be in such a way that there should not be any infections for the patient. Why? Because the patients are already having certain diseases, and any other infection would deteriorate the condition of the patient. So, to prevent such infections, so we have to follow certain systems like good HVAC systems, like heated, ventilated, air conditioned rooms wherever required, okay, in the hospital. So, these systems have to be implemented, so that the temperature and the ventilation and air conditioning is available, so that the patient have a healthy environment to stay. And any waste that is generated, I mean a lot of waste is generated within the wards. So, this waste needs to be disposed properly for to prevent any infections from the waste. So, there has to be a mechanism for waste disposal. So, that has to be adopted within all the inpatient wards. And the patients, since we are putting a patients within a hospital and the patient has to stay there for a longer duration, so they should have an ample ventilation and natural light to have a view outside on and off, so that they do not feel that they are restricted within the hospital. Okay. And also they should have a reduced noise levels, because the patients are coming with pain and they are suffering. So, we cannot see that the patients are disturbed by different noises that are coming, so that they should have a cool and calm climate, so that they can take ample rest and recover from the diseases. Okay. Now, location. So, where these inpatient wards are to be located into the are placed in the hospitals. So, these inpatient wards are away from the heavy traffic areas of the hospital. So, what are heavy traffic areas of the hospital? The outpatient, where there are a lot of public movement, patients coming from different areas, moving here and there for registration, outpatient consultation, going for diagnostic, all this will be the heavy traffic area within the hospital. So, the inpatient has to be away from this. So, why? Because if you see in the previous slide, we have seen that the patient has to be in a cool climate, noiseless environment to have ample rest and recover from the diseases. So, that is the reason these wards needs to be available away from the busy traffic areas of the hospital, and they should also be accessible to ICU, operation theatre and diagnostic services. Why should they be accessible? So, if for example, if suddenly a patient in a ward has some critical illness that develops suddenly, so at that time the patient should be easily transferable to a critical care area, or any surgery that is planned, the patient has to go. So, it has to be well connected to operating theatres, and also diagnostic services. Day to day basis the patients are analyzed, observed, treated, and to assess their fitness for discharge. So, certain diagnostic services are required. To get those services done, these wards should have an easy access to the diagnostic services, and also they should be well connected with lifts, stairs and fire exits especially. So, lifts where the patients can easily move from one floor to the other floor of the hospital in a vertical structure, and stairs where again the patients who are able to walk, who are a little fit and fine, so they can walk through the stairs, and fire exits. In case of any fire accident, they should have a fire exit plans and have a proper indicators or signboards like, okay, this is the way to fire exit, and the patients can be evacuated easily through the fire exits. Okay. Now, size of the hospital. As per the Clinical Establishment Act 2010 by the Government of India, these wards should have a minimum carpet area. So, how are these designed? Okay. So, now if you see for levels of hospital, level 1 hospital should have a 50 square meter bed per bed area, and level 2 hospital should have 40 square meters per bed. Okay. And each bed needs to be having a 6 square meters distance, maximum covered area. Okay. And distance between beds should be at least 1 meter. That means beds have to be placed 1 meters away from each other, or if the distance, if you are calculating from the center of the bed to the other bed, again the center of the bed, then the distance should be 2.5 meters. Okay. And in these wards, it is not only for the patient's comfortability, also there should be a place for other people to move around the wards. So, that is the 30% area should be a circulating space, like for a nursing station to be allocated, or doctor's room to be allocated within the ward, and ward stores where different kinds of materials required for IP services are stored, janitor's room where the janitor or housekeeping staff can maintain keep all their materials, and also the corridors and wash areas within the inpatient ward. Okay. And for general ward, every 12 beds needs to have a water closet, 2 water closets, and one area and 1 hand wash, and the doors of the wards and patient room should be minimum of 1.2 meters and corridor should be 2.5 meters. Okay. So, these you can see the statistics here in this slide, and make an understanding how these statistics can be there. Okay. Now, facilities in wards. The total area in the wards can be divided as primary, where patient beds and nursing stations are available; ancillary, where portal, diagnostic equipment, pantry, dietary services are available; auxiliary, where doctor rooms and nursing rooms are available; and sanitary, as mentioned, like washrooms, janitary rooms, sluice rooms, dirty utility area are available. Okay. Different ward layouts. There are different types of ward design: open ward or nightingale ward, a Riggs pattern ward or modified Riggs pattern ward, T and Y shaped wards, and L, H and E shaped wards are available. Okay. If you see here nightingale ward, the nightingale ward has a different setup, where on one area there is a nursing station, on the other area there is washrooms or other utility areas, and the beds are placed parallelly alongside of the wall in a perpendicular direction. Okay. So, features of nightingale ward: patient bed in 2 rows at right angles to the longitudinal wall. It may have side rooms for utilities and perhaps 1 or 2 side rooms that can be used for patient occupancy when patient isolation or patient privacy is important. So, an extra room for a privacy also can be placed. A nursing station and doctor's room and other facilities on the other end can be available, and bathroom and water closet at the other end. This model offers, the nightingale model offers a best good visibility of the patients for the nurses, and it is economical, the patients can afford for this ward, and easy to construct, even from the infrastructure wise easy to construct, and plenty of fresh air and ventilation because it is open, not closed. So, a lot of ventilation is available. And disadvantages: noisy and no privacy for the patient because all the patients are put into a single room, big hall sort of thing, and a risk of cross infection because of many patients staying together in a single hall. So, there is a high risk of infections, and fatigue of nurses since there is a lot of patients are available in the same ward. So, the nurses have to give a lot of care and observation. So, it is a fatigue for the nurses, and space between bed is reduced because you are putting more beds within a less space. So, the space between the beds is reduced. So, this is an example of RIGS wards where it shows small cubicle rooms, okay, and you have seen these different types of E wards, H wards. Okay. And what is a RIGS ward? The first made in RIGS hospital. Okay. So, this is the RIGS method where the small cubicles of 3 or 4 beds are available. Advantages and disadvantages: again each ward has its own advantages and disadvantages, because here the patients have privacy and isolation and privacy, but it is difficult for nurses to view the patients and check on the patients to keep the eye as an observation. So, this is about the part 2 where we have seen different kinds of wards and services and the wards arrangement and locations. So, thank you students, thank you for listening.